don't know that when we embarked on this journey with both these programs that we perhaps fully understood what we were getting ourselves into. And I think that the results at this point, once we get the formal research in, we'll have hopefully even stronger evidence, have probably exceeded expectations. For Essentials of Care, the key aims of that are really about bringing about a culture that supports the practice of nursing and midwifery and providing an opportunity for staff to actually reflect on the care that they provide and identify opportunities to improve it.
The voyage of discovery is not in seeking new landscapes, but in having new eyes. I like this quote. I think it actually explains some of the essence of what the Essentials of Care program is about. The Essentials of Care program uses an emancipatory approach, which encourages frontline clinical staff to take part in critical thinking and decision making. I saw this as an opportunity for our unit to look at the way that we worked and to move forward as a team with a common purpose and goals.
I think the most important thing about the Essentials of Care program and how it was developed is it actually was developed by nurses. So it really did come from that bottom up, and that's certainly the approach that we continue to use.
The thing is, the nurses know what the issues are, and sometimes they have the answers. They really just, the thing they don't know is how to get together as a group and talk about it and come up with some agreeable strategies.
Asking ourselves whether evidence-based practice was translating into the workplace. So that whole idea around we have a certain amount of knowledge, we're educated, we know how we should practice and we understand the evidence that sits with that. Was that really translating when we're working on the wards and the way that we're caring for our patients?
I needed to establish some communication channels with staff. I needed the process to be transparent to ensure that information that was being collected was not seen as secretive. After all, the data belongs to the staff, not me.
Staff feel empowered that issues are being addressed, issues that they've said have been an issue for a while are now being addressed in a timely manner. We can now see evidence that it is becoming part of their everyday practice. And staff can see that the program is truly owned and driven by them, and they have the confidence that issues will be addressed and actioned in a timely manner.
And the values clarification stage was especially important process because this would become our touchstone or our reference point for all future work. Staff initially struggled with this stage, probably because they'd never thought of what was at the heart of their practice, and once they understood what they had to do, they really embraced it and they came up with some fantastic and many interesting points which you can see which is incorporated into that value statement.
I think that the way I see it is that Essentials of Care is about enabling a team to work together and to identify their issues and come up with ways of resolving those. And it's about how they work. What Take the Lead does is it enhances that capability of nursing and midwifery unit managers to assist staff in that process and at very strategic points to actually perhaps provide some specific solutions, such as some of the lean methodologies that they get in terms of dealing with some of the problems that have been identified.
Becoming a nursing unit manager was certainly no accident. I wanted to share my passion for nursing and I wanted to lead a group of people and drive them to experience what I had experienced and to teach them to keep the patient at the centre of everything we do and how to provide qualitative, effective care, but still maintaining the love and the passion for what it is that we do. It made me think, what are we actually managing? Who are we leading? And where did the patient go? Like many other NUMs, I was becoming very proficient at managing my desk. I knew I wasn't spending enough time on the floor. My experience and through my study and research was telling me that to be an effective leader, I needed to be visible and accessible. I needed to be a role model and a mentor for my staff. And on thinking about it and reflecting on it, it became a heartbreaking experience because I thought I'm not the only nursing unit manager that is managing at a desk.
There was also evidence in the literature, both nationally and internationally, indicating that this role, this frontline management role, was changing at a rapid pace. And the people fulfilling those roles were really struggling in terms of having clarity about what is the purpose and the core function of that role.
I like nursing. I'm passionate about nursing. I like the people that we are privileged to look after. I came to take the lead because I originally thought, what have they dobbed me in for now?
I think that for nursing and for leadership within the practice and the profession of nursing, we've kind of dropped the ball a little bit in terms of how do we actually support and enable people to be the best leader that they possibly can. And I think the Take the Lead, the 5 modules that we've developed, really highlights and enables people to be able to do that better.
I've got to say I will be eternally grateful to my area health service, to the Director of Nursing of Wagga Wagga Based Hospital for dobbing me in for this program.
Take the Lead was absolutely made for me. We discussed and validated and reaffirmed why it was so important that a registered nurse is a manager of the ward. It was probably at this point that I had my biggest aha moment, and I've had many aha moments throughout this whole process. But I realised, and I already knew, that the nursing unit manager sets the tone on the ward. But just how much influence we have probably hadn't impacted on me, and it finally hit home.
I am positive the reason behind the fact that we have a lessening of incidents on the ward, it's because I'm out there.
One of the things I did following taking part in the facilitation courses was to move my office onto the ward. Previously, I've been around the corner and down the corridor away from it. It was important to me, to my leadership role, to be visible and accessible to all.
Through Take the Lead, I believe the clinical part becomes more of a clinical leadership, being visible on your unit, being the person that drives change, being the person that leads people to where they want to be.
I think it's been a really, really exciting opportunity for nursing, and particularly for nursing leaders and those obviously in the Nursing and Midwifery Unit Manager role, to reconnect with their passion for nursing and to actually have really nice insight into who they are as individuals and what they bring to the table in terms of the individual that they are, but also the professional person that they are, and the absolute difference that that is going to make to patient care right now and also into the future.
My Director of Nursing has said to me, "You are different." I said to him, "Why am I different?" He said, "You're different now because I don't know if any of you have been privy to Brian Dolan's workshops where he had and I was the ward where, no, we can't do it like that. No, I've got no staff. No, it's their fault upstairs. It's got nothing to do with me. I'll make everything lovely, but it's those people upstairs, blame them." That's stopped now. We all have to be a team. We have to put everybody in the picture, and we all have to be a team. And I have learnt that through Take the Lead.
In some respects, it's almost disappointing that it's had to be this positive, which might sound like a very strange thing to say. I think for me, it's the issue that I think it's sad that to some extent the nurses and midwives had lost that level of contact with their profession and their practice. But what's really positive is that this is putting them back in contact with that. And so that enhances how they feel about their practice, about themselves, and how they then interact with patients in the community. And for me, that's extremely rewarding, and I would think that if we can nurture that to its fullest extent, it can only be good for the health system.